PMHN Clinical Scenarios in Practice, Volume 2. A comprehensive guide for psychiatric mental health nursing assessment and care covering pediatrics, geriatric psychiatric assessment, neurocognitive, personality, crisis intervention, and special populations. By Ashlee Sally Williamson and Victoria Denise George. And narrated by Madison G. Disclaimer. The information contained in this book is intended to provide educational content related to psychiatric mental health nursing practice. The author and publisher have made every effort to ensure the accuracy and completeness of information contained in this book. However, healthcare practices, standards, and knowledge evolve continuously, and this book should not be used as a substitute for professional judgment, direct consultation with qualified healthcare providers, or adherence to institutional policies and procedures. The clinical scenarios presented are composite cases based on clinical experience and evidence-based practice. They do not represent specific individuals, and any resemblance to actual persons, living or deceased, is coincidental. Assessment tools, interventions, and approaches should be implemented in accordance with professional standards of care, institutional policies, and within the scope of practice as defined by regulatory bodies. Healthcare professionals using this resource remain responsible for staying current with evolving practice standards, maintaining appropriate clinical competencies, and practicing within their professional scope. Neither the author nor the publisher shall be liable for any loss, injury, or damage allegedly arising from any information or suggestion in this book. Chapter 1: Introduction to Psychiatric Mental Health Nursing Assessment. The nursing assessment process in psychiatric mental health practice forms the cornerstone of effective care. When executed properly, this process allows us to understand not just the presenting problems, but the whole person, their strengths, challenges, supports, and needs. The psychiatric nursing assessment stands apart from other clinical evaluations in its emphasis on the therapeutic relationship as both the context for gathering information and as an intervention in itself. Through this initial engagement, we begin the healing process even as we collect the data needed for thoughtful care planning. Purpose and scope of psychiatric assessment. The psychiatric assessment serves multiple functions simultaneously. First and foremost, it provides the foundation for identifying patient needs and formulating nursing diagnoses. Unlike assessments in other specialties that may focus primarily.
Sample complete. Ready to continue?